If you're researching Medicare Advantage plans and trying to understand how they actually work, then this is the video for you. Today, we're breaking down the Medicare Advantage process, how these plans work, the pros, the cons, and what people should understand before enrolling. When it comes to Medicare, there are really two main options when it comes to your insurance. There's keeping original Medicare with a Medicare supplement, also known as a Medigap plan, and then there's what's called Medicare Advantage, also known as Part C. Today, we're really gonna break down that second option. What does that actually mean? So a lot of times we get people that call in and maybe have issues, maybe have questions on specific things related to Medicare Advantage. And oftentimes what we come to find out is that these plans were not explained properly to the client in the first place. So that is the entire point of this video today, is to give you the information that you need and the knowledge to feel confident if that's the route that you choose to take. So the number one thing that people need to understand when it comes to Medicare Advantage is this is a private insurance company is going to combine your Part A, your Part B, and your Part D, and they combine all of this on one card with one plan. So what does that mean? The private insurance company actually replaces your original Medicare Part A and Part B. So it manages your Medicare benefits. So again, there are pros and cons to this. We're really gonna touch on the pros and cons here in a minute, but that is the number one thing that you need to understand when it comes to Medicare Advantage, is a private insurance company is managing your Medicare. When it comes to Medicare Advantage, you're probably getting tons of phone calls, tons of pieces of mail, and all of these different things are saying zero premium this, zero premium that, dental, vision, prescription coverage, all for zero premium. One thing that a lot of those, the mail, the phone calls that they don't disclose is you actually have to continue to pay your Part B premium. So you must keep Part A and Part B to have a Medicare Advantage plan. And as of right now, here in 2026, that Part B premium, the standard premium is $202.90. So aside from paying that Part B premium still, remember, a private insurance company managing your Medicare. What does that really mean for you, and what does that mean? So networks are a huge factor when it comes to choosing a Medicare Advantage plan. So there are what's called HMOs, and there's PPOs. There's some pretty significant differences between the two. Those are gonna be your two main Medicare network types when it comes to Medicare Advantage. Health maintenance organization, to keep it very simple, your doctors and hospitals have to be in that plan's network, and most HMOs do require a referral from your primary doctor to see a specialist. The second type of network, a PPO, is a preferred provider organization. This is designed to give you freedom and flexibility. What that means is that you have an in-network and you have out-of-network. And what this means is you do not need a referral to go see a specialist from your primary doctor. So that is the number one difference with a HMO and a PPO. Now, here is one thing that a lot of agencies out there are not going to disclose to you. When they say, hey, you can have a Medicare Advantage PPO plan, you can go see any doctor in the country that accepts original Medicare. And if you hear those words with someone telling you, trying to sell you a PPO, run for the hills, because that is not true. You need to make sure when you go out of the network that your doctor agrees to bill that plan. It is not automatic that they will accept your plan out of network. So you need to check yourself, or have a good agent or agency check that doctor's office for you. So please be aware of that. That is one of the number one things that we hear and we get call-ins from people all across the country for. So networks, be super aware of your networks. And it's not just for doctors, it's for hospitals. It could be chiropractic clinics, specialty care clinics, durable medical equipment facilities, everything you do has a network. So be aware of that. We're gonna help you find the best network or the best plan for your specific doctors, hospitals, anything like that. So when it comes to Medicare Advantage, remember, you're gonna have lower monthly premiums. Oftentimes we do see some as low as zero premiums right now. What does that actually mean for your coverage though? When it comes to Medicare Advantage plans, you're going to have co-pays, co-insurance, deductibles for just about every single service that you do. Unless it's a preventative care visit, a primary care visit, everything else that you do is going to have a copay. Specialist visits, hospital stays, surgeries, physical therapy, emergency rooms, you name it, there's a copay for it. And that's why we never recommend these plans without umbrella coverage. And if you've never heard of that terminology before, that's okay. What umbrella coverage does is those major copays for things like hospital stays, surgeries, emergency rooms, cancer treatments, anything like that. Very simply put, that umbrella coverage covers up those copays, those exposures for you for a fraction of the cost of what a Medicare supplement could cost you. Okay? So being aware, you are going to take on more exposure when it comes to Medicare Advantage plans, and that doesn't just come in the form of copays and coinsurance. What else I mean by that, remember we talked about networks already. The other thing is prior authorization. So remember, a private insurance company is now managing your Medicare, and that word prior authorization, oftentimes it scares a lot of people. So let's really simplify what that means and how that actually works, the statistics behind it with Medicare. So prior authorization, again, does not happen for every single service. It's just going to be for major services. That could be for things like if I need an MRI, if I need physical therapy, if I need to have a surgery, I could have prior authorizations for those services before I can do that. So again, doctor collects the information, they send it to your insurance company, the insurance company takes that, they approve it, and then you can get it scheduled. Now, one thing that has happened over the last year, a new change to the Medicare Advantage program, is they do have to be done and get your prior authorization request done by a certain time period. So this is the first time they've ever done this. So how that works right now, for the first time ever, urgent requests the insurance company have to get done within 72 hours, that's 3 days, and standard requests have to be done within 7 calendar days. This is the first time that there have been bills passed and enforced for Medicare Advantage beneficiaries and the prior authorization process, which is a huge win for all Medicare Advantage consumers. So I've really talked a lot about the downsides to Medicare Advantage right now. And the reason I like to start with that is because when beneficiaries go towards Medicare Advantage, those are the things that you need to be the most aware of, because agencies all across the country, they really want to lure you in with a $0 premium, with extra benefits, dental, vision, hearing, silver sneakers. A lot of you probably get phone calls and mail about grocery cards, grocery benefits. A lot of the time, those things aren't the case, guys. So it's super important. You have to be aware of the downsides to Medicare Advantage. And then if those are okay and that's a good fit for you, everything else is just a win for you. So what are those other things? Well, we can have as low as $0 premiums, right? That's great. Who doesn't want to pay a lower premium, right? That's a great benefit. Things like dental, vision, hearing, a lot of those extra benefits can be a huge help to most seniors. Over-the-counter benefits to help with things like vitamins, minerals, first aid items. Those are all great benefits. Silver sneakers, fitness memberships. That is becoming so much more popular right now. They want you to use these additional benefits, because if you're using those, that means you're being healthier, being more proactive in your healthcare, which means you're healthier, you're going to the doctor less, you're spending less on medical expenses, which means the insurance company is spending less on medical expenses. Okay? So it's a win for them, it's a win for you because you're healthy. Now, this is a common misconception. I'm going to go back to this prior authorization thing from before. Because it's a proactive healthcare, a lot of times when I say it that way, they're like, oh, so when the time does come that I need some form of coverage or care, they're just going to deny it. But again, I want to say I'm here to give you facts, and that is not true. So in 2025, CMS reported out of the millions and millions and millions of prior authorizations and claims that were sent into Medicare Advantage companies, less than 4% of those, so 96%, were approved on the very first request that they were sent in. So out of the 4% that were denied, Medicare Advantage plans do have an appeal process. Out of the 4% that were denied, 80% of those were overturned on the very first appeal process. So in the grand scheme of claims with Medicare Advantage plans, very, very, very little of them actually get denied. And what I can tell you is the services that are most likely to get denied are gonna be things like MRIs, physical therapy or physical rehab, and what we call skilled nursing facility stays. And that is a conversation all in itself. So those were the pros and cons of the Medicare Advantage program as a whole. So how do you actually go about finding what the best plan for you is going to be, how to actually sign up, when to sign up? Well, let's talk about that really quick. So the first thing to be aware of is plans change from zip code to zip code, from county to county. So I always use this as an example. We're about 35 minutes outside of Nashville, Tennessee. So the plans, the Medicare Advantage plans in Nashville, Tennessee are going to be totally different than the plans that are available here in Dixon County, Tennessee. So zip codes matter a whole lot. Plans can change, benefits can change, co-pays, networks, every single thing about a plan changes from zip code to zip code, which that makes it much more important to have a trusted resource on your side when it comes to Medicare Advantage. So zip codes do affect everything. Now, when do you actually sign up for Medicare Advantage? So there's a few different enrollment periods that you really need to be aware of. The first one, the most common one, is when you turn 65 for the first time, you can enroll in a Medicare Advantage plan 3 months before, the month of, or up to 3 months after your birth month, okay? Let's use an example where you worked and retired at age 67. Once you sign up for your Medicare benefits, you can sign up to 3 months before your retirement date, or you have 63 days after you lose your group benefits to enroll in a Medicare Advantage plan. So those are the two most common Medicare Advantage enrollment scenarios that we see. The third most that you probably see tons of commercials on, and where we review all of our clients every single year, October 15th through December 7th is the annual enrollment period. Again, benefits change, co-pays change, networks change. Every little thing about a Medicare Advantage plan can change from year to year. So we review this with all of our clients, and it's important that you review that coverage for yourself as well. There is a lot to know and to learn when it comes to Medicare Advantage or the Part C program, but hopefully this video helped you better understand how Medicare Advantage plans actually work and what you should consider before enrolling. If it did, make sure to like this video, subscribe to the channel, and leave any Medicare questions you have in the comments below. And if you'd like more help understanding your options, we've included links in the description below to schedule a free one-on-one consultation with a Medicare specialist and get a free copy of our Medicare and Retirement Planning book, 64 Plus. Both links are down below in the description. Thanks again for watching, and we'll see you in the next one.